Can HbA1c be affected by low hemoglobin and alternative testing? HbA1c can be affected by low hemoglobin levels, such as in cases of anemia, and alternative tests may be necessary to accurately assess blood glucose control. Here's how low hemoglobin affects HbA1c and some alternative testing options. How low hemoglobin affects HbA1c. Iron deficiency anemia. Impact on HbA1c. In iron deficiency anemia, the lifespan of red blood cells, RBCs, is often extended. This longer lifespan allows more time for glucose to bind to hemoglobin, potentially leading to a falsely elevated HbA1c level. As a result, HbA1c may overestimate average blood glucose levels. Hemolytic anemia. Impact on HbA1c. Hemolytic anemia, which involves the premature destruction of RBCs, leads to a shorter RBC lifespan. This reduces the time for glucose to bind to hemoglobin, potentially resulting in a falsely low HbA1c level. This might underestimate average blood glucose levels. Other types of anemia. Impact on HbA1c. Different types of anemia can impact HbA1c readings in various ways, depending on how they affect RBC production, lifespan, and hemoglobin structure. The result could be either an overestimation or underestimation of true glycemic control. Alternative testing options. Given the potential inaccuracies in HbA1c readings due to anemia or low hemoglobin, alternative tests may be recommended. Fructosamine test. What it measures. Fructosamine reflects the average blood glucose levels over the past 2 to 3 weeks by measuring glycated proteins, primarily albumin, in the blood. Advantages. It is not affected by hemoglobin levels or RBC lifespan, making it a good alternative for those with anemia or hemoglobinopathies. Glycated albumin test. What it measures. This test specifically measures the glycated portion of albumin, another protein in the blood, providing an estimate of average glucose levels over the previous 2 to 3 weeks. Advantages. Like fructosamine, it is not influenced by hemoglobin levels or RBC lifespan. Continuous glucose monitoring, CGM. What it measures. CGM devices continuously measure glucose levels in the interstitial fluid, the fluid surrounding your cells, over time, providing real-time data on glucose fluctuations. Advantages. CGM provides detailed insights into glucose patterns and can be particularly useful for identifying trends and managing diabetes in real time, unaffected by hemoglobin levels. Oral glucose tolerance test, OGTT. What it measures. OGTT involves measuring blood glucose levels at specific intervals after the ingestion of a glucose solution. Advantages. It assesses how well the body handles glucose over a short period and is useful for diagnosing diabetes or prediabetes. Fasting blood glucose, FBG. What it measures. FBG measures blood glucose levels after an overnight fast. Advantages. It provides a snapshot of blood glucose control and is straightforward to perform, although it only reflects glucose levels at a single point in time. Conclusion. Low hemoglobin levels, as seen in various forms of anemia, can significantly impact HbA1c readings, leading to either overestimation or underestimation of average blood glucose levels. In such cases, alternative tests like fructosamine, glycated albumin, CGM, OGTT, or FBG can provide a more accurate assessment of glucose control. It's essential to work with a healthcare provider to determine the most appropriate testing method based on individual circumstances.